My name is Kimberly Palgrave and I am the in-house vet for BCF Technology. Today we're in England at Langford Village and we're here at Wyndhurst Farm, which is part of the University of Bristol Veterinary School. Today we will be giving a step-by-step guide on the use of ultrasonography for evaluation of the bovine reproductive tract. In these sets of instructional how-to videos, what we'll be looking at is machine setup before we get started. We'll also look at how to restrain the cows, ensuring that we're in a safe working environment. We'll then look at how to actually hold the probe, and finally we'll look at actually scanning the cows. Ultrasound can be used to not only diagnose pregnancy in cattle, but it can also be used to evaluate the various structures of the reproductive tract, including the ovaries, the uterus, and also other structures such as the cervix and the vagina. This will allow us to be able to better integrate the information gained from these types of examinations into the management protocol of the farm. Some additional benefits of the use of ultrasound compared to manual palpation or blood tests is that we're able to not only, as we said before, evaluate the pregnancy, but we can also look at the viability of that fetus by visualizing a heartbeat. We can also be able to determine if there's a twin pregnancy, potentially earlier than by manual palpation. We can also look at the ovarian structures, such as the presence of a corpus luteum, or other structures, such as a follicular or luteal cyst. This will enable us to better manage the herd on an entire level. When preparing to get scanning, the first thing that you need to look at is the machine that you're using. There are various types of machines that are available to perform an ultrasound examination in cattle. This particular machine has the console and the probe, which is attached. The viewing device, so what you actually see the image on, is either an external monitor or on a set of goggles. There's also a wrist display. On other machines, these may all be combined into one console. Some of them may be more stationary, while this one you can wear on your hip and walk around with you. You also have the probe, and this is what actually acquires the image. When looking at what you can adjust on the machine to improve the quality of the images that you're achieving, there are three main things that you need to be able to alter. The first is the frequency. The frequency will affect whether you're looking at something in the superficial or near field, so things that are very, very close to the surface of the probe, or things that are further away. So an example of this, of something that would be in the near field, would be an early pregnancy or an ovary. Something that would be in the more far field, further away from the surface of the probe, would be a later term pregnancy, or in a multiparous cow whose uterus has been stretched to beyond the pelvic brim instead of being intrapelvic. When looking at the frequency that you set the machine at, a higher frequency range will give you a clearer picture, better resolution of things that are in that superficial or near field, like an early pregnancy or an ovarian structure. If you're looking at later term pregnancy or a uterus that is potentially a bit deeper down within the pelvis, you would be wanting to use a lower frequency setting. Another feature that you can change is going to be the depth. Again, if you're looking at things that are in a very superficial field, or things very near to the surface of the probe, such as an early pregnancy or the ovary, you would have the depth at a more superficial setting, so you wouldn't be looking as deep. If you're looking at things that are further down within the cow, such as a late-term pregnancy, then you would need to have the depth set at a greater number of centimeters. The final thing that you need to be able to change is the gain setting. The gain is the overall brightness of the image that you're viewing. When you set the gain, be a bit cautious about how high you turn that up, because it will amplify or make louder, more bright, not only the true signal, but also any noise that you have within the image. So you want to ensure that you're getting a clear picture of the actual structures within the cow. So you need to look at your frequency, your depth, and your gain settings. On this particular machine, the frequency and the depth are both set within individual modes. On this machine, there are 4 different settings. The ovary stroke early mode, detail mode, and fetal sexing modes are all looking at structures that are in the more superficial or near field. Otherwise, they're very near to the surface of the probe. Therefore, they will be looking at a decreased depth as they're closer to the surface of the probe when it's in the cow. And you'll also be wanting to have a clearer picture in that superficial field. So, when you're in an ovary early mode, what you'll be looking at is higher frequency setting and a decreased depth. When you're looking at the late mode on this particular machine, what it will be changing is the frequency down to a lower frequency, as we're wanting to get enough penetration down deeper within the cow, and it will also be increasing the depth as well. So in looking at things in the very near field, such as an early pregnancy or an ovary, you would want to have it on a higher frequency setting and a decreased depth, because you're looking at things that are just underneath the surface of the probe. When you're looking at things that are further away from the probe, where you need the ultrasound wave to penetrate a bit deeper down, you will set it on a lower frequency and an increased depth. So those would be things such as a later term pregnancy or a multiparous cow that has the uterus that has stretched beyond the brim of the pelvis. So next, we will be looking at the next component of the ultrasound machine setup, and that is the probe. We've already looked at the console, and now we will be looking at the probe, which is the actual information gathering device of the setup. The probe is what actually goes inside the cow and releases ultrasound waves, which will then interact with the tissues within the cow and then send back a signal to be recorded by the console, which will ultimately give us an image. On the ultrasound probe, this is a rectal probe, which is a linear probe. And what that means is you have ultrasound crystals, which are located along the face of the probe here. Electricity runs down this cable and causes these ultrasound crystals to vibrate. When they vibrate, they release an ultrasound wave, which then travels down into the tissues, bounces off of structures, and is returned back to the probe. That signal is received by the console and translated into an image. The orientation of these crystals means that when the electricity hits them and they vibrate, the ultrasound wave comes down in a line like this. Therefore, you need to understand how to hold the probe to get the best possible image of whatever it is you're wanting to look at within the cow. A few features that you need to recognize are where the tip is and how that relates to what you're actually seeing on the screen. On this particular machine, this probe, the tip is located to the left side of the screen. So I know as I move forward within the cow or backwards, I will know how that relates to the image that I'm seeing. If I move the probe towards the left or forwards within the cow, the ultrasound image will be coming from the left. So anything that is on the left side of the screen will be translating to this part of the probe. Something that you need to remember is that these crystals are a bit sensitive and delicate, and we need to take care of them. So whenever you're holding the probe and it's not inside the cow, it's a good idea to actually cover the face of the probe with your hand to ensure that if you get knocked against a gate, that it won't be damaging the crystals. When you're looking to go inside the cow, the way that you hold the ultrasound probe will enable you to get better or worse pictures. So a couple of tips to remember. If you hold the probe cupped within the palm of your hand and keep one finger near to the very tip, so the very end of the probe, which will correlate to the left-hand side of the screen. You can then grasp the remainder of the probe in your hand, and with your 2 fingers that are free on either side, and potentially your pinky as well, you can then feel the structures that are around the probe, such as the uterus. There are 4 basic movements that we can do with the probe. The first is we can move forward or back, forward or back. And that will enable us to go more cranial or towards the head of the cow, or further back towards the cervix. We also need to ensure that we have good contact at all times, because this will help us to get a clearer picture. So we need to be able to actually push down on the rectal floor. So pressure is very important as well. We don't need to use excessive pressure, but just enough to ensure we have good contact of the probe surface at all times. The next is actually rotating the probe head to be in line with whatever structure we're wanting to look at. The ultrasound wave comes out of the probe in this direction. So if we're looking at a structure that is in this orientation, we'll just need to change the orientation of the probe so that it matches the structure we're looking at. So what that would look like inside the cow is gently moving from side to side. The final movement that we can make is rocking or tilting the probe. This again will help us to get an improved level of contact with the rectal floor to improve the quality of our image, and it will also enable us to get a different view of structures within the cow. So for example, on the ovary, what we may be able to do is tilt or rock side to side so that we can look at all of the structures within the ovary, including the corpus luteum, follicles if they're present, and any potential pathology. So in summary, the ultrasound machine setup will include the console, the viewing device, and the probe. The controls that we can change on the console to improve the quality of the image, depending on whether we're looking at structures that are superficial or deep within the cow, include frequency, depth, and gain. We can also alter the way that we manipulate the probe when it's inside the cow. And the 4 movements that we can make are either moving forward or back, forward or back, adding pressure to improve contact. We can rotate from side to side, or we can rock or tilt the surface of the probe. Next thing that we need to consider before we get scanning is the way that we're dressed and the environment that we're in. So looking at actually getting ourselves ready, we need to make sure that we remove any jewelry, including watches and rings. And put them in a safe place. Next, we need to make sure that we tie our hair back for the ladies. And get it out of the way. Then need to make sure that we have appropriate clothing on. So in this case, I'm wearing a boiler suit or coveralls. I'm also wearing waterproof trousers, and I'm also wearing welly boots. Now we can start to, in this particular instance with the machine that we're using, we can put it on as it sits on our hip. So we want to ensure that this stays as dry as possible. Obviously, the probe will be going inside the cow, but we need to protect the console if possible while ensuring that we keep the buttons, which will control our frequency, our depth, and our gain, accessible to us throughout the scanning period. We have a carry case. Let me clip that in. Next, we'll go ahead and put the scanner on and then make some adjustments. Just as a note, remember to always hold the face of the probe in the palm of your hand so it doesn't knock against any gates and become damaged. I will be scanning right-handed, so I will wear this actually on the left side of my body so that I can control the buttons. If you're using a stationary machine, just make sure that it's out of the flow of traffic and footfall of the cows to ensure it doesn't get knocked over and damaged. But you also need to be able to see the screen without having to crane your neck too much, especially if you're doing a large volume of cows. So now we will put on a waterproof top, which will protect the console and also enable us to have faster cleanup, because we can actually feed the cable of the probe up and through the sleeve of our waterproof top. What this will allow us to do as well is to ensure that this end of the probe with the crystals is kept as close to our body as possible so that it won't become damaged. Palm the probe to ensure that the face doesn't get damaged. Now, we have our waterproof top. We've covered over the console. And we're at less risk of the ultrasound probe flapping around and potentially becoming damaged. Now we're ready to go and prepare our cows. Now we need to look at the environment that we have set up for scanning. Those will largely depend on the farm that you're actually working at. This particular farm at Bristol University has dedicated purpose-built facilities, which actually makes handling very easy. But what you mainly need to bear in mind is personal safety, and also safety of the cows and the other staff members wherever you're working. In this particular facility, we actually have dedicated stocks, or AI stalls, where each cow can slot in individually, and we have good access to be able to perform our examination. You can also use locking head yokes or individual crush or stock facilities. As previously discussed, we do need to have some form of actually viewing the image. In this particular case, with this machine, what we'll be using is a set of goggles that actually shows us the image right before our eyes. So we'll just put those on now. What these goggles will allow us to do is actually view the ultrasound image while retaining our peripheral vision. This is important in a farm environment to ensure, again, safety. If you're using a stationary machine with a monitor, just make sure, again, that it's out of the primary footfall of people and cows, and that you are able to visualize it at all times without having to twist your body or crane your neck.
This video will give you a very brief overview of the anatomy of the reproductive tract of the cow. There are two external components of the reproductive tract, including the vulva and the vestibule, which are not seen on this particular photo. The vulva is the most external portion of the reproductive tract. As we move beyond the level of the vulva, we will come to the vestibule. As we proceed even further, we will then come to the level of the vagina, which is now seen outlined on the photo. It is important to remember the location of the urinary bladder, as the visualization of this structure on ultrasound may be mistaken for the presence of a pregnancy. As we move further cranially, we will come to the cervical region. Beyond the cervix is the uterine body, which then splits into a right and a left uterine horn. The structure referred to as the intercornual ligament, which can now be seen outlined, is located between the left and right uterine horns beyond the level of the bifurcation of those horns from the uterine body. And finally, the left and right ovaries are located in the region of the tip of each uterine horn. On this particular photo, the left ovary has been incised and there's the presence of a corpus luteum, and the right ovary has also been incised.
Ready to get scanning. We have our console, we have our viewing device, and we have our probe. Our cows are set up. It's a nice, safe environment. Everything's nice and calm, and we're ready to go. So we'll put a glove on. I will be scanning right-handed today. We'll just have a quick recap on how to hold the probe and the movements that we can make once we're inside the cow. So firstly, we need to remember this is our leading edge, which corresponds to the left-hand side of our screen. We need to palm the probe. So if we have one finger on the leading edge of the probe, then we know where we are at all times. We then have several fingers on either side that can help us orientate where we are within the cow. So whether we're on top of the uterus or on top of the ovaries, it gives us an idea of where we're actually located. You can use your thumb as a backstop to the back of the probe. This will help us as we're moving inside the cow to ensure that the probe doesn't travel back down our arm. So again, palm the probe, finger on the leading edge, have your other 3 fingers on either side, and use your thumb as a backstop. The movements that we can make are move forward or back, pressure, rotating side to side, and rocking or tilting. Now we're ready to go inside the cow. We will need to use gentle handling techniques, just as you would with manual palpation. So we'll get some ultrasound lube, and I've put that both in my palm and also on the back of my hand. We'll cover the surface of the probe, and we'll use what's on the back of our hand to lubricate the cow. Gently grasp the tail. Use the back of your hand. It's all right, girl. And closing your fingers around the end of the probe. We're now inside the cow. We want to perform our examination in a methodical way. So we can start back at the cervix, travel up to the uterine body, then go up one uterine horn to the ovary and back to the uterine body. Then we can go up the other horn, up to the ovary on the other side, and back down to the uterine body. If we then want to evaluate any structures further, so we wanted to have another look at the ovary or another look at the pregnancy, say if we're going to perform some fetal sexing of that fetus, then we can go back and evaluate that. But we want to ensure that we've seen all of the structures that we can when we're inside the cow. So what we'll now do is locate the cervix, which is a firm tubular structure leading down into the rest of the reproductive tract. And there it is. Don't get confused of the bladder, which you will often see right as you enter into the cow. As you can see, I'm not pushing excessively hard with my arm into the cow at this point. If the cow does have a significant amount of fecal material, we will need to remove that most likely to improve the contact and the quality of the ultrasound image we obtain. If it's a multiparous cow, and we're wanting to evaluate the ovaries, for example, we may need to actually grasp the cervix or the intercornual ligament and retract the uterus back into the pelvic canal so that we can evaluate all of the structures that we need to. In this cow, the uterus is located very nicely within the pelvic canal, so I won't need to do that in this particular cow. What we'll do now is locate the cervix again, move slightly cranially or forward within the cow, always keeping good contact. Then what we can do is travel up one horn, up to the ovary, and we can rock side to side to evaluate the ovarian structures. We can then come back down that horn to the body of the uterus, travel up the opposite horn, evaluate the ovary on that side, and then come back to the body. If there are any other structures that we want to visualize within this cow, then we can do that at this time. Once we've seen everything that we need to see, we can then gently come out of the cow. Now we're going to look at another cow. You can either use the same glove or use a different glove, depending on the protocols on the farm. We'll use a different glove for this cow. You notice that I keep the ultrasound probe, the head of it, away from any potential hazards at all times. We'll now grasp the probe again, get some more lube. Thank you. Lubricate the surface of the probe. Up to our next cow, use the back of our hand. Grasp the probe with the leading edge, hold it in the palm of our hand, use our thumb as a backstop, and go into the cow. We'll again come to the cervical region. We can retract the uterus into the pelvic canal if need be. We don't need to do that in this particular cow. They do begin to strain. Just allow it to pass until they relax. And then gently proceed inwards. Ensure you have good contact. Come to the body of the uterus. Travel up one uterine horn, up to the ovary. Come back down to the body of the uterus, up the other uterine horn. Evaluate the ovary on that side. Back to the body, and then out once more. And this is the process that we follow to examine the reproductive tract using ultrasound in these cows.
I will now describe in greater detail the specific structures which can be visualized on this ultrasound video clip of the pregnant cow. At this stage, the ultrasound probe has been inserted via the rectum into the cow, and we will perform a methodical ultrasound examination of the entire reproductive tract. This includes the cervix, the uterus, and both ovaries. Currently, we are viewing the urinary bladder of the cow. This should not be confused for the presence of a pregnancy or fluid-filled uterine horns. What we can see at the very top of the screen is the cervical region. This is a tubular structure which is soft tissue and hence the gray appearance on the ultrasound image. To confirm pregnancy in this cow, we would ideally like to visualize 4 specific features. That would include a corpus luteum on the ovary, the presence of fetal fluids within the uterus, the presence of fetal membranes, and finally the fetus itself. What we are now seeing is that the ultrasound probe is being pushed further cranially or towards the head end of the cow. We are looking to identify the uterus, and hopefully in this cow, if she is pregnant, we will see the presence of tubular structures filled with anechoic or black fluid, and that's them just there. As we can see, they are quite prominent, and this gives us an idea that this cow is pregnant due to the presence of fluid within the uterus, and this fluid is anechoic or black without the indication of particulate matter. We will now evaluate the ovary on this side. It's the structure on the screen just now. It's a spherical structure, and we can see the presence of several follicles, the black fluid-filled objects on the screen. We will then continue back down the horn and up the other side of the uterus, the other uterine horn. At this stage, the other ovary comes into view with the presence of a corpus luteum, which is a gray, homogeneous, smooth-appearing structure on the screen just now. We will then continue back down towards the bladder, which is now on the screen, and back up to evaluate the pregnancy. We can now further evaluate the pregnancy, and now we see the fetus surrounded by the amniotic membrane. There's the presence of a heartbeat, and the size of this indicates that it is 37 days. We get one last glimpse of the corpus luteum as we come out. We will now evaluate the reproductive tract in this non-pregnant cow. The uterine body can be seen at the top of the screen. We will then look at the ovary on this side. The ovary just starts to come into view here as a spherical structure with several dark or anechoic fluid-filled areas, and these are very small follicles on this ovary. We can also note the lack of distended or fluid-filled uterine horn. As we travel up the opposite uterine horn, we will note that it appears very empty within the lumen, and it has a characteristic star shape. This indicates that the cow is non-pregnant or open. We now see the ovary on this side with the presence of follicles, or these dark anechoic fluid-filled structures. We also have the presence of a corpus luteum. This gives us an indication that this cow is cycling, and we may choose to use this information to manage the cycle more effectively through the use of hormones such as prostaglandin or its analogs.
Just want to say a big thank you to Bristol University Vet School and Windhurst Farm and the staff who have helped us make these videos possible, such as Philip. Thank you.